Okay, so we're continuing with anticipatory guidance. A lot of these are uh, parenting decisions. So as healthcare professionals, it's not necessarily our job to tell people what to do. It's our job to educate them to help them make the best decision for their families. There are different childcare options, and what we can do is teach parents about child development so that they can choose the best option available to them. You also should understand that a lot of these options are very expensive. And so some families have very, very limited childcare options. So sometimes they end up making less than optimal decisions because they feel like they don't, or maybe they don't really have any other choices. I know we've seen some cases in the news when single mothers went into a store for an interview and left their kids in the car because they didn't have a babysitter, things like that. So think about the reality of life for some of your patients. So there are some childcare options. There's in-home care, and in-home care can be with a friend or relative. That may be lower cost or free, but it often comes with a lot of unwanted advice, and sometimes it comes with a lot of interfering in parenting decisions. So that can be a trade-off. There are unlicensed home care providers. Some of those are wonderful, but if they're not licensed, that means they're not being inspected. So the parents have to figure out, is this a safe place for my child? There are licensed home daycares. It's a more home-like environment, usually a smaller group of kids. There are in-home sitters. There are families who hire sitters to come to their home, or even hire full-time in-home caregivers. There's also center-based care. Center-based care, think about a daycare center. Most of the time they are licensed. Sometimes they are work-based. They might be connected to a job, which can be really handy for families. I know if we've seen Grey's Anatomy, they have the daycare right there on site. So when they have a bad day, they can run over and see their kids. That's not the reality for most of the world, but it is a model that would be really, really nice for a lot of us. Daycares typically don't take sick children. Sometimes at-home caregivers may be a little more flexible with that. Any licensed daycare is going to have rules about being able to take sick children. So what happens when parents have to work or they're going to lose their jobs and their child is sick? Not hospital sick, not scary sick, just they have a cold, they have a stomach bug. You don't want to take it to the daycare and give it to all the other kids, which is what a lot of families tend to do. They'll hide the symptoms because they don't have a choice about working. But there are in some places actually sick child daycares that are staffed. They may even be staffed by nurses. And so that kids who are mildly ill can be in a daycare setting while their parents work. When we're helping patients, or when we're giving patients or parents advice about choosing childcare, safety should always be the highest priority. We can teach them what licensure and accreditation means, and whether they want to use that as part of their criteria. When they get referrals, we should teach them they need to check the references. A consistent caregiver is developmentally best for the child. So they want beyond, is this a safe place physically for my child? Is this place licensed? They can also look at things like, is there a lot of turnover? Do they have the same teachers in the classroom most of the time? Or are they switching people in and out all the time? Because consistency is actually better for the child developmentally. We want them to be able to look at the space. Is there enough room for the kids to play? What facilities are there? How qualified are those caregivers? And what activities are done with the children daily? They may also want to look at at how structured the day is. At some daycare facilities, it's very structured, like going to school, and the kids are moved from one activity to the other. At other facilities, they may have a lot of different options, but the children choose what they're doing. And then we want them to look at infection control measures, because infectious diseases that get into a daycare tend to go through all of them. So that's things like, is there a separate space for diaper changes? Are there hand washing? Are there appropriate diaper disposal options? Are there hand washing and sanitation protocols, and is the equipment there? If the sink is in another room, then it's going to be more difficult for that caregiver to wash hands after every diaper change. So is the setup adequate to allow for good infection control? Another thing that comes up sometimes is discipline, and discipline is a parental decision, but we can, again, teach parents about child development and about how to use that knowledge of child development in discipline. So the most important thing about discipline for infants is that parents need to understand what infants can and cannot do and understand. They need to understand child development. Older infants can begin to understand the word no, but it is the adult's responsibility to protect them from harm. We can't rely on an infant's obedience for safety. Infants, toddlers, probably preschoolers cannot be trained well enough to count on their cooperation for safety. So it is always the adult's responsibility to keep that child safe. Infants need consistent reinforcement of limits. They need simple rules, and not very many of them, but they should be consistent. So if we never touch the TV or the outlet, they should be moved away from that outlet every single time so that it's consistent. The environment should be set up to allow for safe exploration. Parents should be taught, put up things that are very expensive or potentially dangerous until the child has learned those limits. Timeout may be used for infants. It should be very, very brief. There is controversy about whether it's appropriate, but it should be very, very brief if it's used. Sometimes it's more of the child keeps returning. You've got, especially that 8 or 9 month old and up, they keep going back to the same thing. You can redirect and redirect and redirect. At some point, if the parent needs to get something else done, they may actually put the child in a playpen or in a location where they can't get to that item, just so that they can continue with their day. That also functions as discipline. The child learns, if I keep touching the outlet, I end up in the playpen and I can't go play with my toys. So, but those timeouts should be brief. We don't want to have kids in timeout for a really long time. At 1 year old, it should be less than a minute. Crying is not a disciplinary issue. Infants cry to get their needs met. And this is one of the big ones. Sometimes parents think of crying as bad behavior, but if an infant is crying, there's a reason, and they cry to communicate. So disciplining children and disciplining infants for crying is not teaching them to behave. It is teaching them that they will not get their needs met. Okay, next section, we're going to talk about some oral care.